All right, this is Health Nibble number 112, and we're going to be talking about fasting because we're going to actually have a group fast coming up next Sunday, the 24th. So if you're interested in joining us for a 5-day fast, starting on the 24th, where we'll do videos before and videos throughout so you really understand what to expect, put interested in the comments, and we'll invite you to that private page. So one of the things I wanted to talk about was when people start to lose weight or they join, whether it's our weight loss program or join fasting, they really get wrapped up in this idea of, I don't want to be hungry. And then, I have patients that come in and they'll bring books. And they'll say, well, I read this book, this diet works, and you don't get hungry, and you can have some grain and you can have a little bit of sugar. Listen. That's not going to work. If you understand hormones and you understand physiology and you understand what happens when you have a diet like the American diet that we've all been programmed to eat, that's full of grain and full of sugar and spikes insulin, and you can see, in this area we have a 40% obesity rate and 70% overweight, and it's not like a, whether you're fat or whether you're skinny thing, that those same industrialized dietary recommendations cause cancer, cause heart disease, cause diabetes, and make us overweight and then resistant to weight loss. So my point here is if you're doing a program that there's at some period where you feel hungry, it's not going to work, because those feelings, if you remember, we have two different pathways that we burn energy, and one is glycolytic. So the glycolytic pathway is what eventually the energy from protein goes down through that glycolytic. Glyco means sugar, lytic means burning or eating. So sugar burning pathways, clearly carbohydrates. You eat a pancake, it turns into sugar like that, right? Obviously fruit juice and soda, things with fructose in them. Glycolytic pathways get processed a little different, but all of those things will elevate your insulin, which is a fat storing hormone. On the other hand, we have ketogenic pathways, which are fat burning. The body prefers this rocket fuel rather than this diesel fuel. So when we lose weight, we have to get into these burning pathways, and this transition from one to the other can be difficult. You can feel like you're going to pass out. You can, and these feelings, this is part of the process. So it's a little bit of pain, but when you understand what it is, this is finally you're making this transition into healthy burning metabolism. And if you don't go through that, you're never going to reach your goals. All right. So look at it as a really positive thing. This is your body transitioning. And then when you are fat adapted, like I'm very fat adapted, and when I go for periods, especially just like one day, I do 24-hour fast. Let's say I'm on Sunday, I don't eat, I play hockey, and then I don't eat till the next day. There are times in there where I feel hungry, but that's when my body's starting to grab sugar stores out of the muscle and pull them out and burn through all that. And once it burns through all that, I just go straight into ketosis, or maybe it was this hand. And that's when all the healing happens. You burn fat. Eventually, if you go multiple days in a row, which is what this block fast is, you start gobbling up cancer cells and autoimmune white blood cells that are eating the body. So autoimmunity, you start getting all these amazing healing benefits. So back to my original point. If you can only eat the average, let me back up. The average American eats 17 times a day. So we have this constant influx of energy. So all the body knows how to do is burn the energy we eat rather than burning the energy that it already has in the body. So if you're eating all day, you're just not going to burn that fat, and it keeps the insulin levels high. And so many studies out there show that when we're eating all the time, it causes disease. And when you eat less and less often, it prevents disease and reverses disease. So if you're eating all the time, and then in this fasting group, Aaron's talked about removing snacks throughout the day. So you have these periods where you're not eating. And if you're just starving through those periods, you are insulin resistant and in the pathway for diabetes, which leads to all these other diseases. So I'm not pointing fingers at you and saying, ooh, you're not healthy. I'm saying that's a red flag. Before you actually, your A1C is so high that you're like absolutely diagnosed with diabetes, think, here's a red flag. I'm 25 years old. I can't go 5 minutes or 2 hours without food. That's a big problem. So that's what part of this process is, where you could just randomly go 24 hours without food and you're doing okay. You might feel a little hungry, some food sounds nice, but it's not like making you, feel like you're gonna pass out. You're hypoglycemic, which is insulin resistance. So let's wrap it all up. When you feel a little hungry, think of that as a good thing. And the longer you can go like that, the more transition you're going into fat burning. When you all of a sudden keep going like that and then you're not hungry anymore, your body's rocking those ketones and burning fat and healing and all. So that's a really positive thing. So it's a little pain with a purpose. If you're just terribly hungry, like you're going to push through it, push through it. If you were out in nature and you couldn't eat, you're not just going to die. Your body's going to switch the metabolism so you survive. So, if you're on drugs like metformin and, these diabetes medications, that can get a little complicated. You need a coach. That's what we do at Midwest Functional Health. But just understand what all of these symptoms of hunger and the levels of hunger actually mean in regards to your health. So that's your health nibble number 12. And if you want to join us for a 5-day fast, if you're not up for that, totally fine with that. You can make it at 2, you can make it at 3, and a lot of times people get into these and they get past that hunger phase at day 2, and they're just rocking it. And it's a mental game, and it's actually a spiritual experience to get through a 5-day fast, just water and minerals. But if you're interested in that, it doesn't mean you have to do the 5 days. I would encourage that, but even jumping in with a group, it's really motivating. So type in interested in the comments and we'll add you to that private group. See ya.